That, it is now my pleasure to introduce Rosanne Swanson. Rosanne is the Patient Relation Coordinator at Exeter Hospital in Exeter, New Hampshire. She has been in the patient relations role for 10 years and at her organization for 13. She's been teaching this course for the past 13 years at her organization and also at the University of New Hampshire for graduating nurses. She also has a clinical background working as a medical assistant. Rosanne, the floor is yours.
Well, thank you, Allie. And hello, everybody. Good afternoon. Happy Tuesday to you. I hope that this topic is something that you that will, I hope that it gave you the opportunity to say, I have some difficult situations that I deal with, but I also hope that this will give you today some tools, maybe tips that will help you. This is not only for your work situation. This is definitely for, it could help at home. It could help with coworkers. It helps with a lot of things. So on the first slide, I would like to just introduce to you a little bit about this, this presentation, dealing with difficult situations. And I hope, again, that this course will help you to identify when someone is upset or truly irrational and out of bounds. And as you go through the presentation with me, I hope if you need to, take some notes, take some tips on what can help you, and also sometimes if you do have some questions, let me know at the end. Also, we want to be able to deal more effectively with that irate or that irrational person. And again, we want to prevent people from behaving in an out-of-bounds manner, and this is, again, sometimes very difficult. It does become a difficult situation. So again, good afternoon, and we're going to move forward to the next slide. And so I want you to take a look at that and the slide with the faces, thank you, that shows these people. These people, I picked them because they do look angry, they look upset, they look mad. Could this be someone that you're dealing with on a daily situation? Maybe this is sometimes could be yourself as well. So sometimes these, it could be a face of someone also with no expression or someone that might even be crying. This again is going to clue you in that there is something that's not right, something that might be making them upset and sometimes makes it very difficult to deal with someone in this manner. So on the next slide, thank you. Tips for your toolbox. These are going to be tips that I'm going to help you with today to fill that toolbox up. So it will help you with situations that you're going to be dealing with. The difficult ones, the ones that you look back on and say, I really could use help, but I don't always know what to do. So take your toolbox and let's move on, okay? So the next slide, please. So remember that we see things from different perspectives. So if you look at this picture, the gentleman on the left sees a number 6. Gentleman on the right sees a number 9. Again, just because you are right doesn't mean I'm wrong. You haven't seen my side, life from my side. This is really a situation that I know I deal with a lot in my role. So as Patient Relation Coordinator at the hospital, I will let you know that it is sometimes dubbed or called the complaint department. Sorry to say, I don't want it to be called the complaint department. I do work in patient relations, and I always want to hear the feedback from our families, from our patients, and from our staff as well. What is it that we hear? So again, it's not a right or a wrong, but it is the information that maybe they're perceiving today. We want to remember that, again, someone might be seeing something in a different way than you. So always remember this. I like this little picture. I think it really means a lot to people to look at this and say, you're right. So if you go to the next slide, the next slide is the danger. This is the danger, poison. I call that the poison in my organization. When people are labeled, when we label people with names like that drug seeker, the frequent flyer, the complainer, the crabby person, the whiner, I also want you to just stop and reflect for a moment. Is this something that you may be doing? Think about your organization. Think about your role, the people that you interact with. Are you doing this? Because I have to tell you, sometimes it is the staff that cause the difficult situation. Sometimes it is us that inadvertently do revert back to the poison, don't forget, of calling someone a name. And I will tell you that this is something that I have seen in the past and something that I work with people a lot on. There are going to be a lot of people that are shaking their heads saying, yes, that is me. Sometimes I do that, Roseanne. So when I am working with the staff and I'm working with our patients, what can we do better? The first thing I try to train everybody is to not use the label. So let's go to the next slide, please. And so this is what you should do when you are going to approach someone. When you're going to talk to someone or you're going to converse with your coworkers and say that we need to, follow up with someone, please use their name. Use your name when you're introducing yourself, always. And it is nice to sometimes give them your title so they know who you are, why are you here. And again, their name when you're addressing them or when you're talking to someone else. The names Archie, Summer, Ellie, Violet. When someone calls me to say someone needs to talk to you, Roseanne, they're very upset. If you think about the previous slide, I don't want you to call them the drug seeker, the complainer, the frequent flyer. All I know is the best way to start to interact with someone, especially a person that is angry or upset, is to call them by name. And that's exactly what I do. And I always use my name so they know again. You form that relationship when you use each other's names. So think about this again when you're talking to someone on the telephone, when you are interacting with people in person, face to face, always use their name and use your name. And so take little notes if you need to. Some people say, I'm not good at remembering people's names, Roseanne. So I will encourage you to please take notes, especially if you're at your desk and you can always jot down someone's name or their spouse's name. And when you use that name, that's going to, again, break the bridge a little bit. It's going to give you that opportunity. It gets more personalized. So use someone's name and always use your name. It's very, very important to do that. So now my next slide is a slide that I love to share. It's advice from a patient. And I will actually, I know you can read it, but I'll read it as well. Just think about this. Think about you as the caregiver and think about you someday as the patient. This may be a normal day at work for you, but it's a big day in my life. The look on your face and the tone of your voice can change my entire view of the world. So just remember, I'm not usually this needy or scared. I'm here because I trust you. Help me to stay confident. I may look like I'm out of it, but I can still hear your conversations. I'm not used to being naked around strangers. Keep that in mind. And I'm impatient because I want to get the heck out of here. Nothing personal. I don't speak your language well. You're going to do what you're going to do what to my what? And I may only be here for 4 days, but I'll remember you the rest of my life. So this is your need to know. Your patients need your patience. You also have to have the understanding again. What does it feel like to be the patient? So do you know someone or have you been a patient? And think about these words. Do these mean something to you? And how about if you're the caregiver? Are you the nurse? Are you the medical assistant? Are you the provider? Are you someone that's going to be taking care of someone today? So try to remember these words from your patient and remember that this could be you someday. You might be that patient that feels the same way. So now if we want to go to the next slide, these are going to be some of the tools that I'm going to help you with for learning on what to do, how to service recover, what to do when you're in a situation where You're dealing, again, with a difficult situation. Now, sometimes I use the word customer, sometimes I use the word patient or their family. But the customer is usually generally what we use in this teaching session to say the customer could be anyone. It could be who you're dealing with on a daily basis. Could be an insurance company, could be the billing department, could be a patient, could be their family, could also be the coworkers. So when we're going to talk about some of these tools, this is really for anybody that you're going to be dealing with. So again, you can take a lot of these tools and use them at home as well. So the first thing is we call service recovery. So in my role as patient relations, that is what I am asked to do. Come and help the staff to service recover. If there's a situation going on and there's an upset person or an angry person, they may say, can you come up and talk with them, Roseanne? We call that service recovery. So we have a couple of steps. The first one we'll talk about is the meeting the practical needs. So when you are going to work with someone and you are going to say, okay, well, we want to acknowledge that person. So by acknowledging them again, we should be doing, greeting them promptly and courteously. Give them their full attention. Look at them. Don't forget, you can at that point when you're acknowledging the person, call them by their name. Okay? Now we also want to clarify the situation. So ask questions. Determine things, but make sure you listen, okay? You want to clarify the situation. Don't assume you know what is wrong already or you know what is the need is. Make sure you definitely take that time to listen, and then you can summarize it up. So the third step is we want to meet or exceed the need. Okay? The thing is, this is going to set us apart, or it's going to set you apart from others by you want to make sure that you're going to take the time to find out what the situation is, but we want to meet or exceed the need of that patient or that person that is having a concern. We also want to confirm the satisfaction. Ask again, is there anything else that we can do? Is there anything else that you need? And on all four of these, I will tell you, and I would like you to know for a moment, do you know the one that gets missed the most? The 4 steps: acknowledge the person, clarify the situation, meet or exceed the need, and confirm the satisfaction. So the one that gets missed the most is going to be that we confirm the satisfaction. There are times when people will go through everything, but they kind of drop off when it gets to confirming. That's when you want to say, is there anything else? Did I answer your questions today? Did I get you what you needed? And sometimes we do miss that. That sometimes can really cause the problem to be more difficult because that person might not feel that everything was completed at that time. So these tools, again, when you're trying to meet someone's practical needs, what is it that they need? And you want to talk to them and make sure that you clarify exactly, right? We want to find out, get to the bottom of what has escalated the person, what has gotten them upset, or what is it that they really need. So these steps should help you to do that. I'll also go through a couple more slides and then give you a lot of examples of how you will be able to use these tools as well. So on the next slide, that slide is to, we want to meet the person's personal needs. So on these needs now, if you notice, it will be you want to maintain or enhance self-esteem, you want to listen and respond with empathy, and then you want to involve the customer. So at this point, think about the maintaining and enhancing the self-esteem. This is when you want to treat the person very important. You want them to praise them when things are appropriate, show appreciation, be kind and sincere. What does this mean? An example of a kid falling out of a tree, and you made the right choice to bring your son to the ED. Sometimes you have to maintain and enhance their self-esteem. A mom is like, should I have really brought my son to the ED? I don't know. I had concerns and now I'm worried. So that personal need, we want to make sure that we can respond and enhance our self-esteem. Listen and respond with empathy. When you listen actively, you really have to just listen. And you definitely want to respond with facts. Don't judge someone. And there is a difference between, listening and then doing the responding part of it. You want to make sure that you give them a chance to say what they need to say. And then when you respond with empathy, you always want to make sure that you let them know that I can only imagine how this feels for you today. I understand how you are feeling very upset today. When you involve the customer, there's the customer again, could be your patient, could be the doctor, the nurse. This customer could be anybody that is, that you work with on a regular basis, that this is the person that you're going to involve. So when you involve the customer, happens to be the patient or the family, you want to keep them informed, but you want to also ask questions. So what could we do differently? What can I do today to help you? It might be something as easy as doing the listening part to make sure that you can make the person feel that they are heard. Okay, so let's move on to the next slide, and the next slide is the slide that I will tell you is what I do every single day, taking the heat. So this is an acronym. The taking the heat is a 4-step process for addressing emotions and turning a dissatisfied patient to a satisfied patient. Again, could be a coworker, could be your spouse, could be your mom, whoever the person is. We want to focus now on the person that is dissatisfied. What are we going to do to help them? So if you move to the next slide, please, I will tell you that this is what taking the heat means. The acronym H is for hearing them out, E is to empathize, A is to apologize, and T is to take the responsibility for action. So in my role again as patient relations, I will tell you that this is something that I use every single day. I use this here. I can use it at home. You can use this in the grocery store. You might need to just talk to someone, and someone might just need to have someone hear them out. So when you hear them out, I want you to know that you really need to listen attentively, avoid interrupting. And again, you can use nonverbal acknowledgement, like when you're hearing someone and really listening to them, you could just do some nodding so they know you're listening and you're taking in. When I take notes, so when I'm visiting someone, whether it's a patient inside of a room, someone in the emergency department, someone that's calling me on the phone, I will take little notes, but I also make sure that I am, listening to what they have to say, but also, again, that nonverbal. So on empathizing, right, you want to let the person know you're listening and trying to understand why they are feeling the way they are, okay? So think about, again, you need the facts. This is from the patient's perspective now. This is what they are telling you about the concern. And, the feelings part of it is what the person is feeling. So this is very important for you to empathize and know that there definitely is, especially in a difficult situation, this is when a patient or a person really needs somebody to understand how they feel. The apologize part of it is, I want to tell you that the patients want to hear you're sorry for the problem or the inconvenience. You can apologize without taking blame or fault. For example, you could say, I'm sorry that you're upset, or I apologize that it's taking so long. I regret that you have been inconvenienced. On the steps so far, the A is the one that I will tell you that sometimes I get from the staff. Staff will sometimes say, I want to take the heat, Roseanne. I do want to listen and empathize, but apologizing is hard. I didn't do it, so why am I apologizing? Why do I have to say I'm sorry? And again, you have to remember, you don't take ownership for what happened, but you can definitely say you're sorry for what happened. And the T for take responsibility, right? The T in heat is very important because now you want to help resolve the problem. You take responsibility to do that. You want to also involve that person. You want to involve the people that are going to help you to say, what is it that we can do? So taking the heat, again, is very, very helpful. And when I am asked, how do you do your job? You work in patient relations. The majority of time I hear from people that are unhappy, that are dissatisfied. Sometimes they are yelling. Sometimes they are swearing. So we're going to go back a little bit to when we were talking about maybe at the beginning, the unreasonable maybe, that person that could be a little out of bounds. So we're going to talk a little bit about that. I'm going to tell you some stories. I'm going to give you some examples to let you know on what we can do, taking the heat. I smile and I use this every day. So when someone asks me, how do you do this? This is the answer. You take the heat. Try this at home. Stop for a moment and think, is there someone that I could really use this on? Maybe I need to go home and talk to my husband or talk to my spouse, talk to my children, talk to my neighbor, and I really need to take these steps because I haven't really been listening or understanding what their situation is. You will come back to yourself or hopefully come back to me someday and let me know how taking the heat works for you. So I want to give you some examples because there are truly times when I am definitely involved with a patient that is upset or someone that is truly getting to be irrational. They start to yell. They're demanding. Sometimes they're slamming their hand at the front desk. So in whatever circumstance you have, I do work in a hospital. I did work in doctor's offices prior to this, so I have some examples that work for most anywhere in the healthcare field. So also on how to deal with deal effectively with that person when they become irate or irrational. So don't forget the tools from the toolbox on really taking the time to listen and to take the time to find out what got them that way, what got them escalated, why are they so upset. So some of the things I will definitely let you know that you shouldn't do is to tell somebody to calm down or to stop it or that this behavior is unacceptable, because I will tell you right now that definitely escalates a person that is upset already. So I'd also like to stop for a moment and think, has this ever happened to you? Or have you said to yourself, was that really me? Situation where maybe you were the patient or you had a family member or a friend that you had to bring to a doctor's appointment or to an emergency department, and maybe that irrational or that person that was truly upset and was irate and was yelling, could that have been you? And if it was, I'd like you to stop and think about for a moment, what did get you that way? Was it because the staff maybe were rude? Was it that maybe your appointment was so late and nobody apologized? What was it that got you that upset? And really take notes on that, because that will help you to understand the next time you are dealing with a difficult situation. This might help you to say, I remember when that was me, or I remember when I was part of that. So when someone is being irrational, or they may be raising their voice, I have to tell you that the taking the heat. I do this over the phone, so those of you that might say, I never really directly see people, Roseanne, but I talk to them a lot on the phone, or also in person. So let me go back to the phone. So when you're talking to someone on the phone, I always say you have to set boundaries. You should always set boundaries for yourself in the atmosphere that you work in. So if you're speaking to someone on the phone and they are irate, they're yelling at you, please take the heat. Try to listen to what they're saying. Take some notes so that you'll be able to also read back to them or say to them what you hear them saying, what's the problem, and empathize with them. You have to think about the day. How was the day for you this morning? Did you get stopped at some lights? Could you have possibly dropped your coffee on the way into work? Or maybe they didn't make your coffee the way you wanted it today. How did you start your day? Did your kids miss the school bus? What started the day? Sometimes that could be you, right? It could be a difficult situation that you started the day. How does that affect the way you work the rest of the day? Also for the patient, your patient might have had the same type of morning. They may have started with dropping coffee or just having a bad interaction before they got to work. And I usually use this as an example, and I will tell you this morning as I was walking up the front steps of the hospital, there was actually, it looked like a big cup of coffee with ice cubes all the way down the steps, and I thought, oh no, this is the start of someone's day. Someone dropped their coffee on the front steps of our hospital. Not sure if it was a patient, not sure if it was one of our coworkers, but I want you to know that it probably didn't set the morning right. But I hope that they realize that that's not anybody's fault. And so hopefully they were able to move on and realize that now they're going to, have to deal with the day, get another cup of coffee, or remember that this isn't anybody's fault and you shouldn't take this out on other people. But again, getting back to, was that really me? Was that me that yelled at someone? Was that me that was very, seemed controlling to someone? So if you're the person on the phone talking to that person, again, give them some time. Hear them out. Let them talk and tell you what the situation is. You want to do the best you can to listen and to really empathize. I really can hear how upset you are today, and I'm really sorry. And please, when you apologize, you really need to be sincere, because an angry person can always tell when you're just using the words, and take that responsibility. What can I do to help you today? What is it that I can do that will make this better for you? I will tell you that the part that is difficult, it was for me, not as much anymore, because I use these tools a lot every day. But when I'm teaching this class, I have people say to me sometimes, that's tough, Rosanne. It's really difficult to do. But I will tell you, the more you do it, the easier it gets, just like anything in life. But I also want you, again, to remember, set the boundaries. If you don't have a lot of time to talk on the phone, which most people don't, make sure you give yourself the time. If a patient or a person is starting to repeat and say the same thing over and over, that's when you know you can interject. And you can say, well, Rosanne, this is what I've heard so far from you. And then you can list off the things that you heard and the thing that's really upsetting them. You can apologize again, and you can work together. Let's see what we can do. I really want to help you with the situation. However, I have been asked, what about the patient, Rosanne, that is swearing? We don't want to get sworn at. We don't think that we should get sworn at. So again, in this role, 10 years I've been doing this, I will tell you that I have been yelled at and I have been sworn at. And by being calm, always remember to do that. Be calm, speak in a calming voice, do the best you can to not escalate their feelings even more, and also honesty. Honesty is really the best policy. So when the gentleman called our hospital, and this is a nice example that I will help you to understand how to do this. So he called our organization and he was swearing on the phone. And they hung up on him and said, we don't have to listen to this, and they hung up on him. So he called the hospital again and spoke to another department, and they told him, I'm sorry, we do not have to take this. We are not listening to you swear at us, and they hung up on him. So the third call got transferred to me, and it was a very irate gentleman that was very upset. And he was yelling, and I now realize I'm the third person that he's talking to now, because two other people hung up on him and told him that his behavior was unacceptable. When he got to me, the first thing I asked was, so who am I speaking to? And he said, I'm just going to use the name John. And no offense to anybody by the name John. But John, how are you doing today? Sounds like you're pretty upset. And I asked him, how can I help you? And so John started to tell me his story, but John started to get escalated and started to swear. And this is what I did. I said, John, if you don't mind, I would like to continue talking with you, and I want to help you the best I can. But do you mind not swearing? And he stopped, and I listened, and guess what? John stopped swearing, and he apologized and said, I'm sorry, Rosanne. I'm very upset, but I understand that this is offensive to you. And it was only by me asking him, if you don't mind. And this really does work. Again, be honest. I did tell him it makes me feel uncomfortable, and if you don't mind, let's just continue the conversation, and if you don't mind not swearing, that would be very helpful." And John continued, and he didn't swear any longer. And after I did follow-up with the other 2 departments that spoke to him, they said, "Did he swear at you? Did you hang up on him?" And I said, "No, first of all, hanging up on someone isn't really the right thing to do. Even telling him that this is unacceptable just got him madder. But I was honest, and I asked him, 'Do you mind not swearing at me? It bothers me, and I would prefer not.' And he stopped. And the other departments were a little shocked and said, 'Well, we didn't think about that.' So think about it again. Are you the person that maybe someone needs to ask you, can you, if you don't mind, can you not yell at me? I would like to talk with you, or not swear at me." Now, there are times when someone is going to be in the audience shaking their head going, "Nope, this isn't going to work, Roseanne." And I will tell you that you're right. There are some people that do continue and say, "Nope, I'm going to continue swearing at you, and if you don't like it, it's too bad." And so I will again set some boundaries, and I will also, this is out of bounds, okay, this behavior. So at this point I will say, "I'm really sorry, John, but I think at this time we should probably end the conversation. Maybe we can end the call now and we can call each other back. You can call me, or I'm happy to call you back, but I think at this time it's a good time to maybe end our conversation." I've only had to do this twice in 10 years. The other hundreds of calls that I've had, I have been able to, deal with the situation and really resolve it right there with the person, again, just by being honest. So think about you, think about how you feel, and if this is someone, it's a coworker, it's a spouse, it's someone, whoever you're dealing with, honesty is always the best. It will help them to realize, and sometimes they need those boundaries to say, "Wow, I didn't even realize I was yelling at you." So that's a situation where I really like to help you with the taking the heat. So now if you want to go to the next slide we're also talking about taking the heat. Taking the heat is going to help with these difficult conversations. Because again, when someone is upset, when someone is crying, when someone is yelling, it really, really is hard. It is a hard conversation to have. You just have to buckle up and say, "I know this is what I need to do." So when we avoid that difficult conversation, okay, we trade that short-term discomfort for long-term dysfunction. So what happens is people start to feel not heard. People feel like, well, maybe your organization really doesn't care. Maybe you just want to deal with me, and if you're not happy with the situation, you're going to just let it go instead of trying to, what I call, service recover, right? Taking that heat, taking that opportunity to reach out to someone, to talk with them, whether, again, on the phone or in person. Either way, taking the heat works. I will tell you, once you do it, you will really be surprised and say, "She's right." So Allie did mention that I teach this class in our organization. I've been doing it for 13 years. I've taught the class over 100 times, but I was invited to UNH College last April, and I was asked to come and speak with the class, the graduating nursing class. And they thought dealing with difficult situations was a great title. So I presented this class to the students that were graduating within a couple of weeks. And I want you to know that so I did the class in April, and then around July, I round on patients every single day in our hospital. That means I go to different areas and I go and speak to the patients or their families or whoever is available to talk. I ask them every day, "How are you? How are we doing? Are we taking good care of you? Is there anything else that we could do? Could we do anything different?" And I really think that opening up those conversations, calling people by name, taking the time to listen to them and find out what we could do better, this really generates a lot of feedback. And I will tell you, most of it is very, very positive feedback. The staff and the managers and the vice presidents, everybody here loves to hear the positive. So on the other things that we could do better, how better to do that than to have that difficult conversation and to talk to people and find out firsthand what can we do better. So an example of taking the heat. One of the nurses that saw me when I was rounding on the floors last summer came over to me and said, Rosanne, I know you probably won't remember me, but I was one of the students at UNH College last year, and I took your Dealing with Difficult Situation class. And that nurse ended up telling me that taking the heat was what they remembered the most out of my class, and that they really believed that it worked. And they use it here at the hospital when they're nursing and they're taking care of patients, but they also gave me an example that they use this at home, and it really worked at home as well. So I want you to know again, I know I've said it quite a few times already, but taking the heat is really going to be something in that toolbox that you should be able to use from today on to help you with difficult situations within your life. So please, we'll go to the next slide. And I want you to see that there's a phrase that is going to come. I'm going to tell you a story first, but I would like you to just stop before you use this phrase. So this is going to be something, again, starting today. I hope you'll remember that this is something that you should definitely hold off on in the future. So think about this. I was called by a patient who said, I was given your card, Rosanne, and I was told to call you. And she was very upset. And she said, I got out of work. I work in Boston, and I got out of work, and I actually came to your hospital for a test. And when I arrived and checked in, they said they didn't have the order. So they weren't able to process me, and they weren't able to get me going because they didn't have the actual order for the test that this lady needed. So the lady ended up waiting in the waiting room, and the staff said that they would try to call the doctor's office and get the order. And at the same time, the patient is waiting longer. And mind you, she had to get out of work early, and she sat in traffic. And then she gets to the hospital, and she's getting pretty frustrated because she can't have the test that her doctor ordered for her. So what do you think happened? They called the doctor's office, and they couldn't get through to the doctor's office. So they had to tell this patient that they weren't able to perform the test that day. So the reason the patient was given my card was because she became irate. She became irate because this is the phrase that they said to her, oh, this happens all the time. So the lady was so upset and said, how could it happen all the time? What are you telling me? So she said, well, you know, the doctor's office doesn't always send over the orders, so we have patients waiting. So the lady got in her car and called her doctor's office. And when she called the doctor's office and told them the situation, what do you think they said? That same line, it happens all the time. So by the time this lady called me, after she spoke to her doctor's office, she called me to say, I am upset, Rosanne, and this is really something bothersome. Both departments use the same phrase, it happens all the time. And what I don't understand is, if it happens all the time, why don't they fix it? So long story short, I called both departments. Both departments agreed that they did tell her it happens all the time, and they agreed to me that it happened all the time. And so I asked them what they were going to do about it. So I talked to both department managers, and I did say, this lady needs to come back tomorrow for her test. We need to make this happen. She came here really for nothing, took a lot of time out of work, sitting in traffic, and then being told that it happens all the time. Shame on us. So I'd like to pause for a moment, and I'd like you to think, do you say this? Do you say it happens all the time when you're at work or if you're at home? If you went home and the door slammed every single day, would you not want it fixed? Or if something wasn't working properly, would you just say all the time, this happens all the time, and not get it fixed? Or wouldn't you want someone to fix it for you? So the next time you hear yourself say it happens all the time, please put the stop sign up and say, what can we do differently? So both managers got together, found out that it was an issue One was a new person that was faxing the orders. Another was the department where it wasn't coming through. Long story short, they fixed the problem. They were made aware of the issue, and instead of putting this on the patient, letting the patient know that we were being inadequate and saying it happens all the time, she was very upset because she said, not so much, Roseanne, I understand that things happen, but what really bothered me was that they both threw each other under the bus. It happens all the time. We never get the doctor's orders. It happens all the time. They never send them to us. The hospital always says they didn't get it. And at the end of the day, the poor lady standing in the middle is like, can't you just fix this problem? So I always like to stress, think about if you're saying this, or again, be more aware when you hear someone else say it. When someone is saying it happens all the time, in my organization, my line is, I only want to hear it happens all the time when they're talking about the good. It happens all the time. Every time I come here, you take such good care of me. And when I come here, it is such a good situation. I always get the greatest care. I always feel heard. I have the understanding. So it happens all the time. I hope you hear that and you take the heat as well. These are things that will help you along the way. And again, this might be something that you need at home. If someone is saying it happens all the time, put out the stop sign. What do we need to do? Let's investigate this. Let's move on. Okay, so let's go to the next slide. Silence and smiles. These are my favorite. So if you were in my office right now, you would know that one of the things that I absolutely love, I love to smile, but I also have smiley faces everywhere. So sometimes sitting in my office when I might be having a difficult day, I can look in my office. I have pictures of my family. I have pictures of smiley faces. And this helps me. This helps me to cheer up, to know that things are going to get better. And I also want you to know a smile goes a long way. Even when you're on the phone talking to someone, they can know, they can feel it when you're smiling. So silence and smiles, right, these are two really powerful tools again. Smile is the way to solve many problems. Silence is the way to avoid many problems. So sometimes you have to know the difference of when you should just smile and other times when you should really be silent. To be silent and listen for a while. Make sure you understand the situation and again find out what caused this. Why is this happening? Why did the person, what got them to the point where they were upset, where they were possibly yelling? How about us as a department or yourself in your department? Do you feel that you are sometimes defensive? Do you sometimes answer questions before they really finish asking you what they wanted? Did you really make the person wait too long? Sometimes staff just don't do the acknowledgement part by looking up. You can smile. Even if you're on the phone, you can look up at someone and acknowledge them and just put your finger up and say 1 minute, and they know that you are definitely, they see that you saw them. And again, making the distinction sometimes, was it you? Sometimes I feel as a staff person, sometimes it's the staff that causes that difficult situation. Sometimes we're a little impatient, or sometimes we assume things. We don't get to the bottom of what's really wrong. We just assume maybe we know without asking the question. And again, sometimes we might start the argument ourselves. You might be the defensive person, and you might get the patient or the person, their family, place blame or sometimes complain about your job or your coworkers. Sometimes, again, that's the poison of the organization. Think about what you're saying. What is your message? What are you giving to people that are around you? Because if you're giving them the wrong message, speaking again about the names, when you're calling someone by name, I work in a small, a small hospital, but I know that there are, much larger ones than here. But you don't always know who you are working with or who you are dealing with, even just by a person's name. sometimes this is the situation, and I'd like to bring this up because this gives me the opportunity to let you know that, again, you may be helping with that poison in your department or in your organization. You might be part of the gossip. You might need to just vent sometimes, and that's okay. But be careful where you do it and be careful what you're saying. In a nurse's station where you are working in an area, most of the time there's quite a few staff members in that area, and a family member will say comes to the desk and is waiting because they're being patient because the nurses are talking. Well, unfortunately, the nurses that day that I was there was actually talking about a patient. And they were not really being that pleasant, and they were kind of talking about her, again, the poison. They were calling her names, and they were kind of talking about the person in the open. And the lady standing at the desk actually stopped them to say, well, you know, you're talking about my mom. And she had just gone to the desk to ask a question, and the nurses didn't realize it because they didn't know who she was, and they had offended her, and they obviously offended the patient. And I know afterwards when we talk they didn't mean it, but this is something that happens all the time. This is something that I try to train every single day that I work with our staff, that you need to always be mindful that you could be talking about my relative. Just because they don't have the same last name as me doesn't mean that I'm not related to someone. So you could offend me, or you could offend someone else in your organization, not even knowing you could be talking bad about someone and offending your own coworkers. So please be very mindful, be very careful, because it's hard to undo those kind of things. That becomes a very difficult situation again. It's hard to gain trust again. It's hard to have someone realize, wow, I can't believe that I did that, and what's going to happen in the future, what's going to even happen the next time you see them. So please, if this is you, remember that this is really a difficult situation that you might be causing. So if you go to the next slide, please. So this is how people are going to feel when you connect with them. When you connect with them through taking the heat, doing some service recovery, and the words that stand out, right? Compassion, connect, compassionate, empathy, I hear you, listening, all these communication, all these words are words that I hear on a daily basis when our patients are saying, what a great organization. I love coming to your hospital. I always feel that I get the compassionate care. I always have somebody that's listening. And this is what I want to do, is turn this around so our patient that might not be happy today, the person that might be calling me saying something is not going well, we want to make sure we give them an opportunity to talk and to let them know that we want them to feel the same way. We want them to feel that they are heard and that they can tell us about their situation. So if you go to the next slide is the actual opposite of the beginning. So these are the people that have the smiles on their faces. People in your life, people could be your patient, could be a coworker. This is how we want people to feel after you have helped them deal with a difficult situation. And the next slide is actually myself. So very nice to meet all of you. I actually wish that I could see each and every one of you. But again, I'm Rosanne Swanson, Patient Relation Coordinator at Exeter Hospital. And the card that I am holding is called our We're Listening card. And the next slide will show you that this is my contact information, my name, address, and my email address. And this is the card that we give our patients when they leave the organization after they've had a test or after they've had a procedure or after they've had an admission, and we ask them to please contact me. We let them know that they could get information, a survey from our National Research Corporation, but I also encourage them to call, write me a letter, or email me with any concerns they might have, any feedback that they want to share. And I will tell you that just from using this card for the last couple of years, 4 years I believe we've been using them, this has generated a lot of feedback from our patients, helping us to improve when we can and also telling us when we do a great job. So I'd like to just end to let you know, please make sure that you do self-care for yourself as well. Usually after you're dealing with a difficult situation, there's a time where you also need to take care of you. Take a little break, take a walk, talk to someone, follow up with your manager. If there's a situation where it might not end that day and you might have to deal with it again, we want to make sure that you also need to take care of you, okay? Because in order to take care of others, you also have to make sure that you take care of yourself. So I hope that this presentation was helpful for you, and I'd love to know if you have any questions or comments or concerns.
Hi, Rosanne. Thank you so much for that talk. I was really interested in the way you script the apology part of it, because I agree with you. So many people say, I didn't do it, it's not my fault, why should I have to apologize?
Yes.
So I think that I'm sorry it happened to you, or I'm sorry that you feel that way, or I'm sorry that you're upset is such an important script to teach our staff.
Yes, and I'd like you to know that there are as many staff in our organization that really do not want to own it. And I try to tell them at the end of the day, this is not about me, but I'm apologizing. I'm not taking this information and taking it personal. Actually, I didn't do it, but I'm able to apologize for it. And there are many, many people that I speak to that say, the only thing I wanted was for somebody to say they were sorry. So thank you.
Good. I did have a question about sort of the last step of your take responsibility for action.
Yes.
What if you truly can't make it better? I actually had a phone call with a gentleman a while ago who thought that he understood the CMS Medicare conditions of participation, and kept insisting that he had a right to something that wasn't quite accurate. And we ended up going around and around in a circle. I kept trying to say, I hear you, I understand what you're saying, but I couldn't say, you are correct, that is the correct interpretation of these regulations.
Right. So did he have them in writing? Was he able to, or were you able to give them to him and write them so he could actually see them for himself? What the
I think he had looked them up on the intranet and was simply interpreting them wrong.
Wrong, yes.
What he was saying was that he had a right to see the doctor of his choice. And for a variety of reasons, the doctor of his choice wasn't going to see him.
I see.
And so then it becomes that balancing act of the rights of the patient versus the rights of the staff.
Right. And I have to tell you that there are times, not too often, but there are times when you also have to agree to disagree. And sometimes by doing that, you also might be able to involve someone else. So you might be able to say, this is what I've done, and it's still not working, and you might need someone else. You might need someone else to possibly talk to him, sometimes hearing from a different person, or maybe having them say things differently, or like I said, they might need to have it in writing. Maybe you get a copy to them to say, this is it, and highlight the areas where there might be a misunderstanding, and just try to do that. But there are times, again, where there are going to be there's a situation where you might not really be able to resolve. I can't always resolve, but I am at least working on what can we do. And that's one other thing I'd like to have everybody also focus on. Sometimes we focus on what we can't do. We can't do this, we can't do this, and we can't do that. But we should focus on what can we do. So that way you can also, to this maybe even gentleman, well, this is what I can do to help you. And if he doesn't still get it, maybe have someone else, like I said, speak with him or send him something in writing. Sometimes when people see things, on paper, they may understand it a little bit more. I hope this helps.
Yes, thank you so much.
You're welcome.
Thanks, Rosanne.
You're welcome.
Does anyone else have any other questions for Rosanne today? If you do, you can press *7 on your phone to unmute yourself. Okay, well, thank you so much, Rosanne. You did a wonderful job. We loved seeing your smiling face at the end of the presentation as well. And you really helped us, and I think it sounds like you're in the perfect job for yourself. So thanks again. And if there are no other questions, we will convene for